If you're pregnant and you can't seem to get to sleep because of your back pain, tossing and turning all night, let me tell you, you are not alone. Hi, I'm Dr. Deeptee Jain, and I'm an orthopedic spine surgeon, and I've helped hundreds of women get through the night. Today, I'm going to show you the best sleep positions for pregnancy-related back pain and how small adjustments can completely change how you feel every morning. I will also say that I share this from personal experience as someone who just went through pregnancy. So why is back pain often worse when you're lying down? Well, during pregnancy, the center of gravity actually shifts forward. The curvature of the spine increases, and there are also hormones, like relaxin, for example, that make your joints more flexible. All of these things together, when you lie flat at night, your spine actually loses its natural support, and the muscles that help stabilize the spine during the day when you're upright don't work as well. Add that to the growing weight of your belly, and your lumbar spine and your sacroiliac joints can get compressed, twisted, feel pressures that they haven't felt before that aren't necessarily normal for them, and especially if you sleep on your back and stomach. But the good news is that simple positioning and pillow placement can make a massive difference. And then there's one additional intervention that I will tell you from my personal experience made a huge difference. So what is the best sleep position? The best sleep position for most pregnant women, especially after 20 weeks, is actually sleeping on the left side. And here's why. Sleeping on the left side improves blood flow to the uterus and to the kidneys because it keeps the pressure off the major vein that runs along the spine, called the inferior vena cava. Most importantly, it also keeps your spine in a neutral and supported position. So here's some tips that you can use to actually help set it up properly. You could try placing a firm pillow in between your knees. This helps keep your hips level and reduces pressure on your lower spine and the pelvis. You can add a very small pillow, and I think a lot of that depends on the size of your belly, but under your belly, and that gives you some gentle abdominal support. And this can prevent your spine from rotating forward. You can use a supportive pillow behind your back, which can prevent you from rolling flat onto your back in the middle of the night. And if your upper back hurts, and this was the case for me, you can add a small pillow or a folded towel under your rib cage for support. Some women will use a U-shaped pillow or a C-shaped pregnancy pillow, but it doesn't have to be fancy. The principle is simple. Support the curves and keep the spine in a neutral position, and that's going to take as much pressure off the joints as possible. So a few important don'ts. Try not to sleep flat on your back, especially after the second trimester. It can compress those major blood vessels I was referencing and reduce oxygen flow to both you and the baby. Now, if you roll onto your back into the middle of the night and you're a back sleeper, not to worry. You're not damaging you or your baby, but you might find it more comfortable to sleep on your left side. Avoid stomach sleeping. This might seem like a no-brainer. It's probably not going to be that comfortable to sleep on a big belly, but it also strains your neck and your lower spine. Like I said, if you wake up on your back, don't panic. You can just roll back onto your side. The key is to keep most of the night in a supported position. Pregnancy back pain at night isn't just a sleep problem. It's a quality of life problem, and you deserve to rest without pain. Now, my one added tip that I will get, and I will just say this from personal experience, when I had a lot of upper back pain during pregnancy, is actually daytime physical therapy exercises made all the difference for my nighttime back pain. So I personally went and saw a physical therapist to engage in strengthening exercises in my back, as well as stretching exercises for my upper back. And these actually had a huge difference for my nighttime back pain. So tonight, let's talk about your sleep position, the support, and your neutral spine. Try sleeping on your left side with a knee pillow, a small belly support, and a back cushion. And you might be amazed at how different your spine feels in the morning. I'm Dr. Deeptee Jain, and every week I share spine-backed tips to help you move, sleep, and try to live as pain-free life as possible, even during pregnancy. So hit subscribe, and I'll keep sharing helpful tips, I hope, that can keep your spine healthy, and small adjustments can make a world of a difference. Sleep well.